The Center for Tobacco Products, which is part of the FDA, is charged with regulating them. But because there's so many out there and there's not much work known on them, we were fortunate to get funding to study them. And my contribution to this is metals, right? So I love zinc. It's a positive metal. There's also lots of toxic metals, and we did these early studies, myself and some colleagues, both in the pharmacy school and the dental school, where we were able to show that if you buy different electronic cigarettes and you examine what's in the solvent, if you will, there's things like lead and chromium and nickel, which you don't want to be inhaling. And so we and others have shown that there's toxic metals in these products, and now we're trying to understand what happens to the effects on physiology. And so that's where I got involved in this. And again, I think it's this example of having such great interdisciplinary research here. My colleague Richard Dalby, we have two electronic cigarette smoking machines. We can vape any product you want and tell you what's in it. So there's really, it's just been very interesting, and hopefully it will affect human health in this manner. So there was the Smoking and Tobacco Control Act that regulated conventional, combustible cigarettes, and then there was an amendment to that. So now we also will regulate e-cigarettes. So they actually have to go through an approval process, even though they're potentially toxic, to be manufactured. There's a lot of different angles, right? That there's one angle is who they're being marketed to, right? So the initial intent for these products is they're a reduced harm alternative to conventional combustible cigarettes because they don't have tobacco in them, right? They have nicotine, flavorants, which are a little bit variable. Inadvertently, we learn metals. But they were being marketed to teens, right, and young people. They were, the way that many of these products look, they look like little flash drives, or they look like little, they're designed in a way. So there was a lot of controversy about that. And then over the years, they've taken away some of the different flavorings and some of the different components. Things have been banned. But it really, so that was a problem. And then there have been all sorts of different reports of different constituents causing different health effects. Some of them are anecdotal, some of them, we have more evidence for. And it's just, people think they're regulated because you can buy them, in a store, but at this point, we're still at the point of figuring out what to regulate. So I think that's the challenge.